Welcome back to Business Talk here on businesstech.co.za. As always, I'm your host, Michael Avery, and today we've got a really interesting discussion lined up with Maria Makhabane, who is the Chief Growth Officer at Discovery Health. I love titles like that because they really speak to the heart of what Discovery is all about, growth and innovation. And as we know, Discovery is really a pioneer in the insurance industry, very well known for its innovative approach and its customer-centric solutions and its shared value approach to healthcare and so many other things now, including insurance and banking. Maria has extensive experience and strategic insight, leads a very diverse portfolio and includes groundbreaking products like Flexicare, trauma cover, prepaid health, as well as gap cover. And today we're going to talk a little bit more about that innovation suite and the intersection of growth and innovation. So, Maria, great to have you on the show. As I said, you need a very diverse team. How important is it to Discovery to continue to innovate in a category and in an insurance sector that is so ultra competitive in South Africa?
Yeah, great. Michael, thank you so much for having me today. It's just a great pleasure to be chatting to you. You hit the nail right on the head. There's like nothing simpler to answer than it's in our DNA. Innovation is in our DNA. And so if we were not innovating as Discovery and Discovery Health, pushing ourselves forward, we really wouldn't be the Discovery that you know and all of us love. So one is just it's like our bloodline, and we have quite a beautiful annual process of innovation and bringing that to fore. It's really, really important for us, particularly in the health business, which is one of the longest standing businesses in the Discovery Group. As you know, we have a stronghold within the open medical scheme market, and we also administer some restricted medical schemes. But over and above that, where the growth portfolio and its diversity comes into it, is non-scheme products, which we're seeing as the newest area of growth. And I'm leading the charge in actually pushing ourselves outside of our traditional boundaries in terms of medical scheme cover and administration and managed care.
I think that's so important, that distinction between the two, because often when you get to a certain size, one looks at an organization that has built up this reputation in one particular area, and especially when it comes to the scheme cover that you mentioned, and then you think, well, how much more innovation runway is available? But to your point, there's lots available in some of those adjacent sectors, isn't there?
Yeah, spot on. So about between 8 and 12 million South Africans are enjoying medical scheme cover in the country. The rest are either funding their healthcare through out-of-pocket expenses or relying on the public healthcare system. And so part of the innovation that we are leading now is to increase that scope of coverage for those into the quality private healthcare sector. And we do that through a slew of products, like a portfolio, which I lead. So everything from a pay-as-you-go product, which is Discovery Prepaid Health. As and when you need healthcare, it's a vouchering system. You just purchase it and you go visit your provider. All the way through to health insurance, which is our Flexicare product, which is a day-to-day cover for things like unlimited GP visits, dentistry, optometry. Some wellness screenings are included in that. A very good, comprehensive but basic basket of primary health care. And then we have another category which creates access to emergency care, accidental trauma cover, both through casualty as well as hospitalization within specific benefit limits, 400,000 Rand, R1 million. And so that kind of creates quite a comprehensive laddering up to what is the most comprehensive of all of our offerings, which is the medical scheme environment, right? But given the pricing pressure and the economy at the moment, we need to innovate and create that access at lower price points, which is what this broader growth portfolio actually enables.
And obviously within the restrictions that still sadly are placed on schemes, thanks to the foot dragging around regulations for low-cost benefit options. And that is frustrating. But let's talk specifically about Flexicare, because this product has seen incredible growth in recent years. What exactly is Flexicare, and how does it provide a unique value proposition to customers in that laddering up as you referenced?
Yeah, great. Thanks, Michael. So Flexicare is our day-to-day cover offering. It offers a pretty comprehensive primary health care solution for individuals. And we cater to both individuals, so you can buy it direct from Discovery Health or our partner, Auto & General. And we also cater to 550 corporates. So employers that may not be able to necessarily put everyone on a medical scheme, but are able to provide some type of healthcare coverage for their employees. The product comprises of the likes of unlimited GP visits within our networks, access to optometry, dentistry, rad pathology, so those type of basics. It also includes a basic wellness screening. So imagine it's quite powerful actually for individuals that previously may not have had access to a private healthcare system. They would be getting glasses for the first time, getting a full wellness screening and check for the first time, understanding their health end to end for effective chronic management, etc., for the very first time. And so that's kind of the solution that Flexicare is within the space of health insurance.
It sounds like a revolutionary solution. And I'm sure as Discovery, you sit and you look at the data, you're always data-driven in your innovation. Do you have any insights you can share looking at the data about how significant Flexicare's impact has been in South Africa so far?
Yeah, certainly. So we're really proud to be supporting 120,000 members on our Flexicare product at this stage, which is just phenomenal. With every year, we have 22,000 GP visits, as an example, which, if you think about it, is quite impressive. 1 in 5 members is visiting a GP on a monthly basis, which is really, really cool. So I think quite a profound footprint already, and it's a product that is growing quite rapidly, particularly if you compare it, that category, particularly if you compare it to medical scheme growth, just given that it's so nascent at this stage. 2023 was a great year for us. We saw 30% growth in demand for Flexicare, and that's been both in terms of individuals taking money out of their own pockets to fund it and purchase it, as well as additional new employers that are coming into the fold. We have one employer that's been with us for 10 years now on this product, which I think is quite remarkable, our first employer. But we have new employers joining the fold at different sizes, almost on a weekly basis now.
But it shows you that, the product has been around for some time, but I think there's still a lot of runway to go. And, the ability for this to offer, access to primary healthcare in a way that's, for ordinary South Africans has been, prohibitively expensive. And that's why we had the health market inquiry and why there have been debates about NHI. It's how do we improve access to quality healthcare? And here's something that is doing that. You do have variations in what you offer, though, because you've got Flexicare, but you've also got Flexicare Plus. Who are each of these products targeted at? And maybe you can just share a little bit more about what differentiates the Plus from the Flexicare.
Yeah, with pleasure. I mean, I think our conversation up to now, you're seeing that the major piece of innovation within this segment is really being able to substantially change the entry pricing in order to access this type of private healthcare. So we have 2 products within the fold: Flexicare, which is the Flexicare Core, as well as the Flexicare Plus product, being a bit more premium. The Flexicare Plus product comes in at about 40% of an entry-level price for a medical scheme. So just to give you a quantum in terms of just the difference that's making in terms of entry into the specific segment. The difference between Flexicare Plus and Core is how you would enter the healthcare system. Through the Flexicare Plus, your first port of call is a GP, so your general practitioner, your doctor. Through Flexicare, because we're able to reduce the price further there, the entry point into the healthcare system is through a nurse-based consult, and then you'd be referred up if and when you need into a general practitioner, either virtually or through a physical visit to throughout our network. So that's the major differential between the two. The Flexicare Plus product is also enhanced as it covers 27 chronic conditions, including HIV, both the management as well as the medication within that. But those are the two key big differences.
Yeah, but it's, again, amazing if you apply the right triage, for lack of a better word, in screening, how one can actually reduce costs and open doors to new entrants into the healthcare sector. There's still room, I'm sure, to improve. From where you're sitting, how do we improve the value that primary health insurance products offer? And are there any gaps, again, no pun intended, in the current market that Discovery Health aims to address? Because I know there's been a big rise in things like gap cover and all of those ancillary products as well.
Yeah, certainly. I mean, I think where we started was innovations in our lifeblood. So, we're certainly not resting at all at this stage, and we are pushing the product forward. I mean, there's benefit changes that we are introducing to the core Flexicare product itself, and we do that annually. The latest would have been the addition of the specialist benefits, so access to more specialist level care, through that both Flexicare Plus product. But in addition, it's that stretch that I was talking about in terms of allowing or creating products that create more of that access into initial hospital cover. So through casualty, through ambulatory service, through some benefit, obviously benefit limit hospitalizations on specific emergency trauma as well as medical conditions. That's effectively where the expansion of this cover is going. So we know we have a great package from a primary care perspective. We continue to obviously enhance, but over and above that, we're broadening that up the ladder in terms of hospital as well.
And I mentioned NHI earlier. It's such a big topic in the health industry. So I've just got to get your broad view on it. What is your view on NHI and the role that you have to play as we continue to debate things like affordability and suitability? What is your view on NHI?
Yeah, sure. I mean, it's quite a blessing to be working on this portfolio as we embark on the topic of NHI. Me and my team, what we work on is increasing and opening up access to healthcare more broadly beyond just the medical scheme and environment. And so I think that works hand in hand with the ultimate goal of what NHI is aiming to achieve, which is universal access to healthcare. So Discovery Health and myself were very much alive to this and agree with the aspiration of expanding access and creating universal healthcare access for all South Africans. So I think that's where we start the discussion around NHI. In its current form, as you're aware, the bill is not fully workable, primarily from a financing perspective. And I think that's going to take time to actually resolve into a model that is much more workable, both from the financing as well as implementation perspective. We see this as a minimum of a 10-year journey to get to that stage. And in the interim, both the medical scheme environment as well as the health insurance segment of which Flexicare is a part of will play a massive role to continue to create that access to private healthcare.
That's such a good point. Someone emailed me the other day to say, Michael, what do we do with our existing medical schemes? There's NHI, there's all this talk. And I said, don't panic, don't worry, continue contributing to your scheme because the schemes are not going anywhere. I was chatting to the Minister of Finance at this year's budget, and on NHI, he said, no one's really costed it out yet. We as Treasury, we can't fund any proposals that haven't had any of those studies done. And so much more does need to be done before we even get to a phase where we are talking about implementation. But it's a great, catalyst to see all of the innovation that is happening around lowering the barriers to entry. And I think Discovery, as always, really at the vanguard of that, Maria. So looking forward to seeing more innovation coming out of South Africa's leading health provider in the private sector. Thanks so much for your time.
It's been wonderful. Thank you, Michael. Appreciate it.